Hey, I'm Tina with Nona Home Healthcare. I'm the Director of Nursing. I'm here to demonstrate how a bag technique works. So in the middle is what they consider your cleaned area. Every bag is going to have a box of gloves and a thing of wipes. If these are too heavy for you, you can put these in a plastic bag, and it needs to be closed while you're in here. In this area as well, you're going to have your blood pressure cuff, your stethoscope, your thermometer, your oxygen saturation, anything that you use on the patient every time you're going to have in this middle area, because we're going to clean it off and put it back in after every visit. This outer pocket, you have gel and soap. Flip it around, and on this outer pocket you have a sharps container that you can lift the closures up and just close them gently for multiple use. When you need to close them completely, you bend these tabs down, they go in here and they lock in. Then you can bring this back to the office. But this stays on your bag at all times, just in case you need it. This pocket here, this outer pocket, we have the barriers and paper towels in case you do have to wash your hands. Okay, so let's begin. You would wear your scrubs to your appointment. You would wear professional shoes, make them look nice. You don't want all dirty, scuffed up shoes. Your ID badge with every patient all the time. Hair appropriate. Most of the time when I'm in the field, I actually have my hair back. It's better for the patients if you're not having hair falling all over the place. When I get to the patient's house, I introduce myself. I explain to them what I'm there for, especially if they don't know me. A lot of times I see starts on the weekends. I find a clean, flat surface. You can't be putting your barriers on top of bags on the table or mail or whatever that they have. You need to find some kind of clean, flat surface, if it's a chair or if it's a table. And then you will put your barriers down. So I'm going to use 2 barriers because they're kind of small, and then I'm going to order larger barriers for you guys. So as I'm doing this, I'm explaining to the patient why I'm doing this. I tell them, I'm putting these barriers down. That way I don't transmit any germs to you, and you don't get any germs off of my bag. They're usually okay with that. Then you set your bag down. You have to prepare ahead of time for what you're there for. If you know you're there for a dressing change, you're going to take out a few sets of gloves. You're going to take out a set for taking off the dressing, another set for putting on the dressing, and another set just to have in case you drop something on the floor and you don't have to want to go back in your bag. Every time you go into your bag, you have to gel your hands. First thing I do is I get my gel out of the side pocket, and I'm going to get my soap. On this side pocket I have some paper towels. You only have to use soap and water if by chance the patient has C. diff. Every other thing you can use gel for, but they recommend soap and water if the patient has C. diff. Then I'm going to get all my other supplies out I need. I know I'm going to need my stethoscope, blood pressure cuff, O2 sat, since that's part of your everyday vitals now, thermometer, and because I'm doing wound care on this patient, I'm getting 3 pair of gloves out just so I'm safe. 3 pair of gloves. And then I'm also going to get about 3 wipes out. 2 for the supplies and 1 for my tablet when I'm done seeing the patient. Okay. Now I'm going to go see my patient. Take care of everything with her. Once I use the blood pressure cuff, I will put it back on my barrier. Same with the stethoscope and the thermometer. I'll put it back on the barrier. When I'm done seeing the patient and I've touched the patient, I'm going to come over here. All my gloves will have been used by then. To throw away gloves in a house with a dressing change, you would put them in like a plastic Walmart bag, tie it up, and then you can put it inside the patient's trash, or you can take it to their outside trash if they have it. So these gloves would be trash. After I'm done touching the patient, I'm going to gel again before I touch my supplies for about 30 seconds till it's dry on your hands, between your rings and bracelet, whatever you have on. And we do that again because I may touch the bag, the inside, as I'm dropping things in and putting them back where they're supposed to be. So my thermometer, which this thermometer is great. I don't even touch the patient. It's like a scanner, like they're at the grocery store. My O2 stat, clean off the inside. I clean all around and down the wiring because that might have landed on the patient. My blood pressure cuff, all the way around and on the outside because you never know what touched the patient. And all the wiring. And we'll just put that one down. Take this one and clean it all off. I know the earpiece didn't touch the patient, but just to be on the safe side, clean everything off. Now all of that's ready for your next patient, so you can close that up. These are completely ready. Put them back. And all of this can just go in the regular trash. It doesn't need to be double bagged or anything, just the patient's regular trash. You throw it away.